Okay, welcome to our presentation. The topic is sclerosis lateral amyotrophic. So let's start with the name of the partners. And is Antonia Caro, Juliet Gonzalez, Alejandro Acosta, Valeria Torres, and my name is Juan Andres Sanchez Moreno. Okay, about the amyotrophic lateral scoliosis, this is a disease that affects motor neurons in the brain and the spinal cord. Is neurodegenerative, so could be hard. This is hard because the neurons are responsible for the movement and control of the muscles that could be help us for walking, talking, eating, and breathing. Well, about the ELS or scoliosis lateral amyotrophic, some causes is the progressive death of neurons. This leading to increasing muscle weakness, and this could be the beginning of the loss of muscle mass. Some of the initial symptoms could be the walking or the difficulty of walking, the stumbling, weakness in the hand or legs, difficult speaking or swallowing, and muscle spasms. Well, about the pathophysiology of ALS, ALS is characterized by the progressive loss of upper in the brain's motor cortex and lower in the brainstem and spinal cord. Also, the glutamate is an excitatory neurotransmitter that at high levels can be toxic to neurons. And in ALS, a dysfunction of this could be observed in the regulation of glutamate, leading to its accumulation and neurological damage. Obviously, the mitochondrial dysfunction or mitochondria, which are responsible for energy production in cells, show alterations in their function in ALS, contributing to lack of energy and cell deaths.
Hello teacher, hello everyone. Today I will be discussing the pathophysiology of amyotrophic lateral sclerosis, commonly known as ALS. It's a progressive neurodegenerative disease that affects motor neurons, leading to muscle weakness and atrophy. So let's talk about some specific things about this condition. Firstly, we will talk about axonal transport dysfunction. Axonal transport dysfunction is a process by which molecules and organelles move along the axon. This transport is crucial for the survival and functioning of neurons. In ALS, this process is compromised, leading to impaired delivery of essential materials to neural cells, thereby affecting their survival and contributing to the disease progression. Next, we have protein aggregation. Sorry, it's in my mind, but and ALS affects cells. There is a accumulation of misfold proteins such as TDP43 mutate SOD1. These protein aggregates can be toxic and contribute significantly to neural death. Another critical aspect is inflammation of the immune response. Is the central nervous system of ALS patients. An inflammatory response has been identified, including the activation of microglia and astrocytes. These cells in open to respond to neuronal engineering. Can be exacerbate neuronal damage to the release of pro-inflammatory cytokines and toxic factors.
Although there is no cure for amyotrophic lateral sclerosis, and various treatments and therapeutic approaches can help manage symptoms and improve patients' quality of life. These treatments include medication. One Relusol, this is one of the few medication. It's believed to reduce damage motor neurons by decreasing the release of glutamate, neurotransmitter that can be toxic at high levels, and to edaravone, This medication acts on antioxidants and can help the progression of disease in soft patients. Two is therapies and care, physical therapy, maintain strength and mobility, prevent contractures, and improve quality of life. The patients, stretching exercise, muscular stretchings, and gait training. Occupational therapy help patients perform daily activities independently. Use of assistive devices such as wheelchairs, adaptive utensils, and home medications. Speech therapy is improved communication and swallowing. Exercise to strengthen facial and tongue muscles. Swallowing compassion techniques and argument is an alternative in communication device. In invasive ventilation improve sleep quality, reduce fatigue, and prolong survival. Purpose of the article. The purpose of the text is to provide an overview and possibly a discussion of amyotrophic lateral sclerosis, probably with the goal of informing readers about the disease, its characteristics, potential causes, and current knowledge and the medical community.
ALS is a devastating disease marked by progressive degeneration of motor neurons. The exact cause of ALS is still unclear, but is likely influenced by a combination of genetic and environmental factors. Treatment options for ALS are limited and focus primarily on symptoms management and supportive care to improve quality of life. Research efforts are underway to better understand the pathophysiology and ALS and develop more effective treatments.
The author goals appears to be to educate readers about ALC, its clinical manifestation, pathophysiology, diagnosis, and possible treatment or management strategies. Although no explicit state the author's main thesis could be inferred as ALS is a complex neurodegenerative disease characterized by the progressive loss of motor neurons, leading to muscular weakness, paralysis, and eventually death. And the current knowledge suggests a multifactorial etiology involving genetic and environmental factors.
Lastly, let's consider the genetic factors. In the familial cases of ALS, mutations have been identified in several genes that have such a weird names. One of these genes are FUS. These genetic mutations are involved in pathogenesis of the tissue and can affect various cellular mutations, including those we have previously discussed. Understanding these genetic contributions is crucial on revealing the complex mechanisms of ALS. So, in conclusion, ALS presents a significant challenge in both diagnosis and treatment due to its complex nature. The interplay between axonal transport, dysfunction protein aggregation, inflammatory response, and genetic factors makes it multifaceted disease. Therefore, there is a critical need of continued research to enhance our understanding, improve diagnosis, and develop effective treatments of ALS. Thank you for your attention. I'm happy to take any questions you may have. Maybe no.